Medicine to treat overweight and obesity. 1. General principles when using drugs. The main goal is to lose 5 to 10% of your weight within 6 months after starting treatment. Health behavior change is the cornerstone of obesity treatment. However, health behavior changes alone are often not enough to achieve obesity treatment goals, because it usually only reduces 3–5% of weight and cannot be maintained for a long time. Obesity medications are considered for weight loss and improvements in metabolic and/or health indicators when health behavior change therapy alone appears ineffective. In case of failure to achieve weight loss goals through lifestyle intervention, in patients with BMI greater than or equal to 25 kilograms per m2, pharmacological treatment should be considered. 2 drugs of choice in the treatment of obesity are orlistat and liraglutide 3 milligrams. Factors to consider to decide on the right medication for overweight or obese people, plus cause of disease, plus psychosocial factors. Emotions and preferences contribute to obesity. The mechanism of action, side effects, safety and tolerability of each drug must be considered in the presence of comorbidities and medications being treated by the patient. Drug cost, route of administration, and frequency of use can be barriers to treatment adherence. Review the medications you are taking that may be causing weight gain, and replace appropriate medications if necessary. If you do not achieve your weight loss goal, you need to re-evaluate other factors that lead to medication failure, such as plus inappropriate dosage or non-compliance with treatment, plus barriers to changing health behaviors, plus psychosocial or medical problems. Each individual responds differently to each drug. Change medication or other treatment if weight loss is not achieved after 3 months of taking the full, maximum, tolerated dose and there is no other reason for failure. It is recommended to discontinue the drug if weight loss of greater than or 5% is not achieved after 3 months of treatment. However, the drug can also be used to maintain weight loss achieved with a previous health behavior change therapy or a very low-calorie diet. The use of obesity treatment drugs is not recommended for pregnant and lactating women or women who are planning to become pregnant. There is no information on when to stop obesity medication before conception. Medicine of choice for treatment of obesity. 1. Orlistat. Mechanism. Orlistat, a semi-synthetic derivative of lipstatin, is a potent and selective inhibitor of pancreatic lipase, thus inhibiting the degradation of dietary triglycerides into absorbable free fatty acids. Orlistat does not specifically affect satiety or appetite mechanisms. Dosage: 120 milligrams, 3 times daily, taken during or 1 hour after meals. Indications: weight loss or reducing the risk of weight regain in patients with BMI greater than or equal to 30 kilograms 1 square meter, or BMI greater than or equal to 27 kilograms 1 square meter with comorbidities such as hypertension, type 2 diabetes, dyslipidemia, excess visceral fat. Side effects: plus orlistat has many adverse effects on the stomach and intestines, fatty stools, flatus, increased fecal excretion. Plus orlistat may affect the absorption of fat-soluble vitamins D, E, K. Using orlistat at increasing levels, some patients developed urinary oxalate stones, oxalate nephropathy with renal failure, plus some rare cases have severe liver damage or acute liver failure. Contraindications: people with chronic malabsorption syndrome or cholestasis, *note. Closely monitor INR, international normalized ratio, when using oral anticoagulants because orlistat may affect vitamin K absorption. Monitor changes in thyroid function in patients taking levothyroxine, as orlistat may affect the absorption of levothyroxine and/or iodine salts. Monitor cyclosporine regularly due to decreased plasma cyclosporine concentrations when taken with orlistat. Orlistat causes gastrointestinal side effects, so it also limits the use of the drug in treating obesity. Monitor the frequency and/or severity of seizures in patients taking anticonvulsants because orlistat may affect the absorption of anticonvulsants. 2. Liraglutide. Mechanism. Liraglutide is a human glucagon-like peptide 1 analog, centrally acting on pro-opiomelanocortin neurons to increase satiety, reduce hunger, and reduce appetite. Transient gastric emptying. Dosage. The subcutaneous dose of liraglutide treatment of chronic obesity is 3 milligrams per day. The recommended starting dose is 0.6 milligrams per day, gradually increased by 0.6 milligrams each week until the target dose of 3 milligrams is achieved. Side effects: most common is nausea, constipation, diarrhea, and heartburn may occur. The risk of gallstones with liraglutide is 1.4% higher than the dose. liraglutide slows gastric emptying, which may affect the absorption of concomitantly administered oral medications. Today's sharing article will stop here. We invite you to follow the content of surgery to treat overweight and obesity in the next video. If you find this video interesting and useful, don't forget to like, share and subscribe to the channel to watch more information. Goodbye and see you again.